My name is Sophia Babb, and I'm a healthcare reporter with Bloomberg Law. Opioid addiction in the United States has now reached crisis levels. More than 2 million Americans have been affected, and rural areas have been hit the hardest. A possible solution? Telemedicine. Telemedicine is a way for doctors to treat their patients remotely. It's kind of like Skype or FaceTime with your doctor. I sat down with Ann Woodbury, the Executive Director of Advocates for Opioid Recovery, to talk about how telemedicine can be used to treat opioid addiction. Why is telemedicine a viable way to treat opioid addiction in rural areas?
Well, rural areas are rising at a faster rate than urban communities in terms of opioid addiction. States with the highest rate of opioid use disorder, like in the Rust Belt and the Bible Belt, they're just more rural. So treating opioid addiction in these communities is a huge public health priority. Additionally, people that are struggling with opioid addiction sometimes are challenged with transportation or financially, and so the distance becomes a huge issue for them. Lastly, I think there are capacity issues when it comes to opioid addiction and treatment in people that are using evidence-based care. So in order to access the care, a lot of times the closest provider that can give you that access may be hundreds of miles away, and so telemedicine becomes the only viable solution. I think it's important also to know what the three main avenues are for treatment. Behavioral counseling is the first, social support is the second, and recovery medication is the third. And so when you look at those three things taken together, you can see how telemedicine would play into that. With behavioral counseling, that can be done through telepsychiatry or through a social worker. Social support, a lot of times people find that in online communities or even in teleconference type of group support. But the recovery medication is a key part of that, and people who are using medication-assisted treatment are 50% more likely to not die of an overdose. So making sure that people have access to that recovery medication is really important. The challenge is that it takes special certification in order to prescribe the recovery medication, and therefore there's just a limited amount of providers who either have that certification or are frankly willing to treat people living with addiction.
Several bills have been introduced this year to make it easier for Medicaid and Medicare patients to receive telemedicine treatment. Two of those bills include the eTreat Act and the Medicaid Substance Use Disorder via Telehealth Act. Both will be important to the future of telemedicine and opioid use. Thanks for watching, and Bloomberg Law will be on top of this issue and many others as they continue to unfold.